What did I tell you? But it goes on for me. I now have the pleasure of introducing Jennifer Ho. She is the U.S. Department of Housing and Urban Development Secretary's Senior Advisor for Housing and Services. And in this role, she manages the department's work to connect housing with health and social services. Prior to coming to HUD in February 2013, she was Deputy Director of the U.S. Interagency Council on Homelessness, and she shepherded the development of Opening Doors, the nation's first ever comprehensive federal plan to prevent and end homelessness. And here's a point of personal privilege. If you haven't checked out Opening Doors, you definitely should. It provides a powerful affirmation of housing as HIV prevention, which is not done in the National HIV/AIDS strategy. Huh? Okay. Jen says it's more than enough. Join me in welcoming her.
Can I put this laptop down? Or I'm on top of it. If I smush keys, I apologize. It's great to be here. I didn't know I had to come to LA to be re-inspired to federal service. What a privilege to work with these two gentlemen. In a couple of weeks, most of America will not go out to vote. And we'll have midterm elections, and people will roll their eyes about their despair with the federal government. And I just want to say that if you can't listen to these two gentlemen and appreciate the fact that who sits in those chairs matter, then you know, I guess you get what you paid for. So I just really want to say thank you to both of you for your leadership on this. You know, my job at HUD, first of all, I got a new boss. I don't know if folks noticed. Secretary Castro came to us this summer from San Antonio, Texas. Had a chance to spend some time with him over the course of the last couple of months, and let me just say he's fantastic. And I hope that you have an opportunity to meet him. It is significant to HUD that we have a Latino secretary who has personal connections to public housing. And I think that his leadership on this is going to be incredible. Not only that, he's kind of the hottest ticket in Washington, D.C. and at national conferences this year, so he has an enormous bully pulpit that we hope to exploit. I mention it because when Sean Donovan went over to OMB, you know, it's great when your boss gets promoted. It's a good thing when your boss gets promoted. It really, I think, to me, signals the fact that this administration understands at a very deep level that housing isn't something that we do over here. Housing is something that really is foundational to everything that we're trying to accomplish, whether it's better care and better health for Americans as a whole, or whether it's specific to the relationship between housing and HIV prevention and treatment. And so I just want to let you know that having these gentlemen in their chairs is fantastic, and Secretary Castro has asked me to stay on as his senior advisor and work through the issues that we've gotten so much traction on over the course of the last 5 years to carry these things home. So I work predominantly on the work of ending homelessness and on the intersection between housing and health and building better connections between healthcare programs and housing. So I work in a more ancillary way on the work that we do at HUD on HIV and AIDS. I'm grateful, Nancy, for your invitation to come here, and I'll reiterate in my own words, there are a lot of advocates who come to Washington, D.C., who work in Washington, D.C. But there are not a lot of advocates who can actually tell us to do the things that we can do. A lot of folks, I go out, I get yelled at about the defense spending. I can't do much more about defense spending than you can do about defense spending. But Nancy has really been artful in terms of, one, not yelling, and two, telling us to do the things that she knows that we can do. And advocates like that are greatly, greatly appreciated. And thank you so much for all you've done. I know you're not going to disappear off the planet, so just look forward to working with you in many different ways. So folks who don't know structurally, Ann Oliva, who used to be in charge of our homelessness programs, has been promoted to the Deputy Assistant Secretary for Special Needs Assistance Programs, which means that Ann now has both the homeless programs and the Office of HIV under her purview. We were working on these things together under Mark Johnston's leadership, but for those who just kind of want to know, what are we doing structurally, Anne is in that Deputy Assistant Secretary position. And continuing to do the work, I think, of really thinking about the work that we're doing in HIV and AIDS and the work that we're doing on ending homelessness together. And I think it's reflected not only in the structure, but it's also reflected in the way that we are thinking across programs around technical assistance, how we're thinking about what are we doing about Medicaid enrollment and expansion states, what are we doing around connections to the implementation of the Affordable Care Act and all of its different manifestations, trying to think about these things together. I mean, these are populations that we have in common. We're trying very hard not to kind of do the work in silos. And Nancy, we're finally doing what you said, and Anne is posting to fill the position of the director in that office. And so I just want to let you know that we're not always fast, but we're doing what you said. Will Rudy and his team really are the ones who get the credit for the day-to-day work that we're doing. And Will asked me to just let you in on a couple of things, specifically that we're doing within HUD. And then I want to talk about some of the opportunities that I see at the intersection of this work of health reform, ending homelessness, and stopping the spread of HIV and improving access to treatment. First of all, we're a partner in the President's HIV Care Continuum initiative, and really trying to make sure that we, the housers, are at the table thinking about better prevention, better care, and better health outcomes. And it's interesting. My friends at HHS are saying housing, housing, housing more often, and it just warms my little HUD heart. But I think that we at HUD are also thinking about healthcare, healthcare, healthcare a lot more often. So you want to talk about opportunities to exploit. The fact that HUD is raising its health IQ, the fact that HHS is raising its housing IQ, there's an extraordinary opportunity to advance ideas at the intersection of these two things. I think we've talked already a bit about the fact that I think it's a common understanding in this crowd, but I think it's increasingly a better understanding across all our stakeholders that housing is absolutely critical both to prevention and to treatment, and we've got really good data that tells us about that, and that we know that when people are unstably housed, they're more likely to become infected and less likely to get care, less likely to follow through in care, and therefore more likely to get sick. So I just want you to know that we know this deeply inside of HUD. And we're thinking about this not only from the perspective of our special needs programs, our homelessness programs, and our HIV and AIDS programs, but really thinking about it across the broad range of housing assistance that HUD provides. I heard a statistic recently that we brought up tied to the President's My Brother's Keeper initiative, which is that 53% of black children living in poverty in America live in HUD-assisted housing. Over half of all black children who are low income in America live in HUD-assisted housing. Now the good news is, that's great. I'm glad that we're providing that assistance. But what else can we do? And that's a question that the President and the Secretary are asking us at HUD to think about. What can we do because we're the place where people live? What can we do that we are oftentimes, the people who have a connection into people's lives who maybe aren't connected into care, who maybe haven't gotten signed up for the health insurance that's available. So I say that not because I come today with an answer to that, but I want you to know that it's a question that we're asking ourselves. You're the experts. I know many of you will yell at me and tell me that there are lots of things that we're not doing as soon as I stop talking, but you're the experts, and I want you to know that this is a question that we're asking, right? I mean, a lot of HUD assistance is provided through housing choice vouchers, and it's not necessarily about a place, but it's probably about a neighborhood. But a lot of the work that we do is in buildings. And what are the right activities for us to be engaged in those buildings? What are the right partnerships for us to be having so that we reach the people that are supported by our programs? One other thing that I wanted to, you gentlemen did such a great job of talking about what we're doing, you're saving me the trouble of all of these small print talking points that I have here. The other thing I want to talk about specifically is the work that we need to get done, the work that HUD needs to get done in partnership with Congress, but really with support from y'all. We're saying y'all more now at HUD with our Texan secretary, is we need to get the HOPWA formula redone through Congress. We don't see a lot of activity in Congress on this right now. But this is something where I think miraculously that even though there are so-called winners and losers in the reallocation of the HOPWA dollars, I think that, and I'm sure you'll let me know if you disagree with this, I think that we have looked at the facts and we have agreed that the facts say that we can't use a formula that was written in the past to address a problem in the future. So one gentleman talked about earlier the fact that it seems like the money isn't where we need it, and it's hard to get new money out of this Congress, but this is an opportunity to take the dollars that are appropriated and to invest them in places where they are desperately needed right now. So we've introduced that legislation, but it's gonna take an act of Congress in order to get this done. And so I just want to remind folks that is a way that we can take the dollars that we have in the environment that we have and use it in a more targeted way, kind of to deal with the problem as it presents itself to us today. The last thing I just want to talk about a little bit is that I think that there is an enormous opportunity in the implementation of the Affordable Care Act and with our friends over at the Center for Medicaid in particular and SAMHSA as well, to be thinking very, very differently about how care is delivered to people with substance use disorders. If you think about one of the most stunning changes associated with Medicaid expansion in those states that have chosen to do it, it's that a group of people who was categorically ineligible under the disability guidelines is now categorically eligible simply because they're poor. And what that means, however, is that a healthcare system that has really worked with people with substance use disorders kind of on the margins is going to have to figure out how to work much more strategically, much more effectively, much more holistically than it has in the past. There are lots and lots of carrots in the Affordable Care Act, but there's one great stick, and that stick is the penalty to hospitals for rehospitalization after a discharge. And it seems to me that that single stick has the financial attention-getting ability of a healthcare system to pay attention to things that historically it has not done well, that it has not paid attention to, and frankly, that it has not needed to pay attention to. So I really want to encourage people to pay attention to this in your communities, because states are being invited by the Center for Medicaid to propose innovations that are targeted to a substance-using population that is newly enrolled in Medicaid. And the Medicaid folks understand and are being explicit about the fact that addressing the housing stability needs of that population is going to be critical to care. So I just want to highlight that because it's it's kind of a policy outlier here, but I think it has the ability to create access to services with an understanding of the linkage between housing and health. And it's going to get policymakers either attention to these issues in a way that it hasn't been, or an attention to these issues differently. And with it comes, again, I think new resources or the ability to apply old resources in new ways that could be really beneficial. I'm happy to take questions that you have, but I just want to kind of leave you with this thought, is that the work that we are doing successfully, reducing and ultimately eliminating street homelessness in America, the targeted work that we're doing with HHS to create a better understanding amongst state Medicaid directors of the importance of housing, and create a better understanding of people who do housing, of the need for people to have access to not only affordable health insurance, but also access to care. I mean, you should jump on all of this motion and make sure that we are being very smart and strategic to make sure that we are using this momentum to do everything that we can to make the right connections for individuals with HIV, individuals with HIV who don't know it yet, people who know it but aren't getting the treatment that they need, and whether they're living on Skid Row. And I reiterate, sir, I hope that the community can come and help offer you a solution that makes sense, because nobody should be living on the streets of this country, and certainly the numbers of folks who end up in Skid Row, that is a problem that we need to solve. But I just want you to know that these are the things that we're thinking about right now. So now is the time, and with the 2+ years left that we have left in this administration, take advantage of the fact that we still have time to get new ideas embedded, so that no matter who takes our chairs after we're gone, they have momentum going forward. So happy to take some questions.